Thank you all for joining us for this cute little webinar. Today, we're going to talk about creating a positive learning environment for students. My name is Whitney. I'm a clinical ambulatory care pharmacist over at State of Franklin Healthcare here in Johnson City. And then I'm also a clinical assistant professor with the Gatton College of Pharmacy.
And then I'm Susie Crowe, and I'm the Director of Experiential Education, and then also an assistant professor in pharmacy practice here at the Gatton College of Pharmacy. So I wanted to just put in a plug for the rest of the webinars that we have planned for the rest of the spring. So this webinar today is part of a four-part series on 4 strategies for becoming a more effective educator. And so part 1 is today. Part 2 will be on the 4 precepting roles when educating students, and that will be on March 26th. We have part 3 on teaching students to think critically on April 16th, and part 4 on adapting precepting methods to meet student needs on May 27th. So please mark your calendars for these.
So kind of that obligatory slide. Neither Susie or I have any financial relationships, unfortunately. So we'll move right along. Some of the things that we want you to get from this presentation include identifying those common challenges in precepting students, which I'm sure a lot will sound very familiar, discussing educational strategies to help improve student performance, as well as determining ways to customize the experiential learning based on that specific student's needs. So to start off, we wanted to discuss some common challenges when precepting. So this is meant to be you kind of floating along. You've got your little parachute, things are looking good, and then we add students into that, and we start getting kind of a hole forming in that parachute that we have. The big hole, I think, for a lot of us is time, having time for students, time to accomplish the actual clinical obligations that we have. Maybe the student, it's the end of their P4 year and they have senioritis and they're just not coming forward and doing what they need to be doing. Potentially we have different expectations. So what we're expecting of the student is different from what they're expecting from the rotation. We may feel that we need to give them valuable feedback constantly or more on a regular basis, and that can kind of relate back to the very first common challenge, which is time, and just not having enough of that time to give them valuable feedback. I think a lot of us are preceptors because we truly want to create a meaningful experience for students. So feeling like maybe we aren't having or giving them a meaningful experience can kind of weigh on our psyche. And then also if there's excessive downtime. So I find this kind of floating into my mind a lot when I have students on rotation and maybe there's a gap between patients and I feel like they have excessive downtime, and that relates back to wanting to make it a meaningful experience for students. That makes me feel poorly. So now we've completely removed our parachute and this is us kind of waiting to fall into the water, and maybe we know how to swim or maybe we're just gonna sink. So how do we overcome these challenges? So I've come up with a couple possible solutions for each of those challenges that I discussed. So as far as time, I think it's important to think about what are you currently doing that isn't essential. So can you move things around to make more time for interactions with students? Is there something that you're doing that you just don't have to be doing, or you can triage to somebody else to kind of help you, another pharmacist or another support staff that could be doing those tasks that you personally don't need to be doing yourself. What types of projects do you have students accomplishing on rotation? So how could they potentially help you? What projects are you working on? And could you potentially give students one of those projects that would be meaningful for both of you. So a meaningful project for them to get involved in, and then also something that helps you accomplish something that you personally want to get accomplished. And then do they need project time to complete that? So that kind of helps as far as that excessive downtime. Maybe they'll need that downtime to accomplish whatever projects you've given them. So I'll kind of go into it a little bit more later, but one specific project that I just had a student do on rotation with me, it was her second ambulatory care rotation with me. She had also had her first AM care rotation with me. So I was like, how am I going to make this a unique and valuable experience? And through getting to know her, discovered that she wanted to become a pharmacy manager and kind of have some more administrative role. So I had personally been meaning to publish our hospital follow-up clinic processes and potentially as a publication for myself. And so I tasked her with interviewing all of the support staff that's involved in our hospital follow-up, our nurse case managers, and myself talking about this, and then our long-term care coordinators. And so she was able to write up our processes from an administrative gain. And for myself, she was able to create something that potentially could be published and also get her name on it. So really a win-win. Another possible solution, so for student commitment, if they have senioritis and trying to get them involved in the rotation, how do we do this? So I think it's super important to discuss your expectations and to discuss them very early, like day one orientation, discuss those expectations. I also think it's important to get to know the student, thinking about what are their motivations, what are they looking to accomplish from this rotation, and set those on the first day too. So what are their goals, and be as specific as possible with those goals. And then throughout the rotation, if a student doesn't seem to be committed, don't assume that they're lazy or they just don't care about the rotation. I think it's important to ask them. So assuming doesn't really get us anywhere. I think it's important to sit down with the student, whether it be, one-on-one, take them aside and kind of ask them what might be going on, remaining curious about their thought process as they're going throughout the rotation. And then for feedback, I'll also talk about this in a couple of slides, but I think it's important to be very positive in that feedback and utilize our SMART goals. So is the feedback actionable or is it just critical? And I think this relates to a prior CE that Kelly Covert did about radical candor and how can we help students improve in a positive way. So one of the things that I do on day one with my students is lay out my personal expectations. And this isn't what it looks like, but I have a Word document that I post so that they can see it throughout rotation and be reminded of it. And some of the expectations on that include at the foundation professionalism. So I tell students that just something personally, I notice when people are late to something. So I make it known that my expectation is that they're on time, 8 a.m. at the latest, at the absolute latest, 8 a.m. because personally, I know that's something that bothers me. So I let students know up front, that's an expectation. If you show up at 8:05, I will notice, and that's something that I expect them to be there. Appropriate interactions with members of the healthcare team and your peers. So again, under that foundation of professionalism. As far as thorough patient review, another expectation I have written on my sheet is that includes coming up with a plan for the patient care and then triaging when needed. So yes, you work up your patient, but my expectation is that part of that patient workup includes coming up with a plan. So you've identified an issue. What are you going to do about that? I'm going to ask you what you want to do about that. It doesn't have to be right or the same answer that I would have, but you have to come up with a plan if you identify a problem. I also expect them to have appropriate communication. For my rotation specifically in AmCare, this means appropriate communication to the patient and also to the provider when they're presenting to them. So for the patient, I'm expecting a lack of medical terminology. And then for the provider, I'm expecting to reintegrate that medical terminology and creating a flow of history that's succinct, but then leads to your recommendation that you're giving. After that, I expect constant learning. So I tell students, my want for you is that they learn at least one new thing every day, or that they understand one thing better every day. So at the end of the day, if we have time, sometimes I'll ask them for that. I'll say, okay, what did we learn today? What did we understand better today? To make sure that I'm also being held accountable for giving them that valuable, meaningful experience. And then at the very top of the pyramid, that autonomy or independence. So I expect them, prior to asking me questions, to try to review it themselves and only to come to me for confirmation or correction on what they found and understood. So I lay that out clearly for them as an expectation so that they know if they ask me a question, I'm going to ask them a question back to gauge whether or not they've tried to understand it themselves, and that I'm only there for clarification, which kind of helps in holding them accountable. I've also started to ask students, we have a acute care clinic at State of Franklin where patients who have a COPD exacerbation, or maybe they have a skin and soft tissue infection or a heart failure exacerbation, they can go there and receive some IV therapy as a means to keep them out of the hospital. So I've started having students go over to that acute care clinic if they see that a patient's there for a COPD exacerbation. What that does is kind of extend my pharmacy services, and then it also allows students to have autonomy because they go over, see that COPD patient, talk to them about inhaler technique as well as smoking cessation if it's applicable, which I think is valuable even if a student is going into community practice, to be able to have that level of communication with their patients and helps them feel clinically independent. So I mentioned earlier about the SMART goals. I just want to reiterate this. I'm sure a lot of you have probably heard about these, but this is another expectation that I lay out for my students. Not only on the first day of rotation and orientation to kind of start thinking about a specific goal that they have and whether or not that goal can be measured, is attainable, is it relevant to what they want to accomplish, and then can they accomplish in the month that they have on rotation with me. But I also tell students to reflect on these SMART goals when they're creating their formal evaluations, so for midpoint as well as final evaluation, so that they're thinking about these aspects of how they're critically evaluating themselves. I think that this is an additional learning piece for students to get comfortable in critically evaluating themselves, and is especially pertinent and relevant for students that are thinking about going for residency, as creating a SMART goal on their evaluations throughout residency is super critical, and a skill that they need to learn.
So for the next part of this, we'll be talking about improving student performance. And so some of the prevention strategies that we can do that kind of help with that pyramid that Dr. Aultman just showed is making sure we're structuring the rotation so that students are really aware of what our expectations are. So first of all, for a syllabus, the College of Pharmacy sends every rotation and every preceptor, every student, a syllabus every month, which is our generic kind of rotation syllabus for all rotations of the same type. However, it's really helpful for students to have a syllabus that gives specific expectations that you might have as a preceptor so that they know those from the very beginning, or even even before you start your rotation, what the expectations are. So if you have, for example, presentations that you have them do, it might be helpful to put that in the syllabus. If you have a specific way you want them presented, I know we have some preceptors that like, for example, for journal clubs, to be on a 2-page or front and back sheet. And then we have other people that prefer PowerPoint presentations. So if you have specific recommendations or ways that you want things done, that's a great place to put that kind of information, as well as how students contact you in an emergency and those types of things too. So that can be really helpful for students. An orientation checklist will help with just making sure that you're not forgetting anything. I know we go through orientations every month sometimes with students, and it's easy to forget to tell them about policies and procedures for your location, for example. So that gives you an opportunity to make sure that you're sharing every bit of information that you need. And I would include in that, like also possibly giving a tour to the student of your site, introducing them to people, and making sure that we're doing that every single month. As far as a rotation calendar, that's a great place to kind of lay out your entire month, and they can see on day 1 in 3 weeks from today, I'm giving a journal club presentation, for example. Some people may have their slides done a week ahead. You know, you can put that on your calendar. I would suggest, if you have both a syllabus and a calendar, to make sure that they match so that you don't have any required expectations in a syllabus that's not showing up in a calendar, for example. I think the goal setting and defining minimum competency fits well with what Dr. Aultman was talking about too. In that, for example, if I know when I was precepting critical care students, that I would say, you know, by the end of the first full week, I expect you to be at least seeing 3 patients and following them fully. So at the end of the first full week, that not only gave me a measuring stick of where the student was in performance, let's say they were only following 1 patient, but it also let them know ahead of time that they're not quite up to meeting your expectations at that point too. And then pre-rotation quizzes can be really good for identifying some knowledge deficits in students. It may help with identifying specific areas that may help the student know what they need to work on for the month, but also you may be able to tailor their experience based on what those identified deficits are.
So kind of piggybacking on what Susie was talking about as far as prevention strategies, critical aspects in orientation, including not only laying out your expectations for the rotation, but also having them set their specific goals for rotation. So I think we do this, we're really good at doing this for patients, having them using motivational interviewing to have them set their goals, like how are we going to quit smoking? So why we don't do it for students too, I think it's super important to do that. So if they set their goals, more likely will they have more drive to accomplish that goal. So making sure that students are vocal about those. If they can't come up with something on the spot, tell them, hey, I'm going to come back to this then. You have to set some type of goal for this rotation. I think that you can utilize a baseline quiz if you would like. I've used it myself a couple of times depending on the month and the students that I have. On day 1, having a baseline quiz that you can also do maybe a modification on that for a final quiz to kind of assess or gauge that student's learning. It may be helpful too if you have an unmotivated student to kind of track their progression as a method throughout the rotation. Setting those expectations and having them visible, reviewing the rotation calendar like Susie was talking about. I find students are really happy when they have a fair detailed calendar just to allow them to know where they need to be on each day. It kind of ties back into some of those expectations that you have. So expectations of where they're going to be when. I also ask students what level of autonomy they're comfortable with. So autonomy is one of my, like the top part of my pyramid of expectations. So I want them to be independent, but I also don't want to make them uncomfortable. So how far can I push you to appropriately integrate you into my practice? Like with sending you to our acute care clinic to talk to a COPD patient, are you comfortable with that? Do you know how to use inhalers? Do you know how you would talk to a patient? Like teach me how to use this inhaler so that we make sure that you're comfortable in doing that before I send you off and you're flying on your own, if that's something that they need. But by the end of rotation, I kind of start to expect them to become more and more autonomous. They have to be able to talk to a patient. They have to be able to interact with a provider. These are things and skills that they're just going to have to do in their future career. So I usually end up trial by fire, kind of pushing students a little bit out of their comfort zone. And I've never had a student tell me that I've pushed them too far. They usually are very grateful in terms of gaining or getting autonomy to practice in increasing their comfort level with that. And then throughout the rotation, remaining very positive, never reprimanding a student. I think it's important to reflect on what type of environment you want to create at your practice. What personal characteristics do you need to work on to create that environment? So just me personally, I can be quick to frustration. And, you know, if something isn't getting done in a timely manner, you know, that's something that I personally need to work on. So being aware of some of those tendencies in yourself and some of those traits in yourself when you're headed down an unconstructive path for students. And I think it's important with remaining positive to acknowledge that if a mistake happens or if something happens, that it's something to solve and that you're not there to punish the student. I think that if it's a punitive reaction that you have, that students then might try to cover up mistakes or hide things from you. And that's really not a good habit for them to start creating for their future career. You want them to feel comfortable in owning something if something is going wrong. So laying that foundation during their P4 year and during their learning process is important.
So I wanted to briefly mention professionalism, because if things go wrong on a rotation, most often it's either professionalism or a knowledge deficit of some sort. And so I won't read through every one of these in detail, but the first one I think is really important, and it's a self-evaluation piece of professionalism. So we all know as professionals, once you're out of the student mode of being either a student or a resident, you rarely get that regular feedback from anyone, and they only have an annual review. And so students need to learn these skills early to self-assess so that it can help them throughout their career. We do have those self-assessment pieces in evalu with the midpoint and the final evaluation. And sometimes I think students look at those as us, you know, just adding extra work to them. But really, this really gives you a chance, if you identify weaknesses in the student and how that they're self-assessing, there may be an awareness issue for the student. And so this gives you a chance to address this at midpoint and final evaluations too. And then also, I think a key take-home point with professionalism in general is if something comes up in one of these 5 categories that are listed here, please address it early, preferably on the same day that it comes up with the student, so that they know what your expectations are. And then should it be egregious or anything like that, please also reach out to our office and we can help you deal with these types of issues. So this is a summary of evaluations of preceptors from May 2019 to currently, so this current academic year. And if you look at this, these are the questions that students are asked about you. That second column is how many students or how many evaluations we had. And then the third column is the overall ranking for all preceptors added together. And this is on a scale of 1 to 5, with 5 being the highest score. So every category averages a 4 or above for sure. But I wanted to point out there are 3 of these that score lower than the other questions. And a lot of it applies to what we're talking about today. And so the preceptor spent an appropriate amount of time orienting me at the beginning of the experience. They explained in detail what was expected of me in regards to work hours, appearance, preparation, performance, attitude, and all of those types of things. And then the final one is that the preceptor educated the staff on the basic goals of the practice experience. So these are good areas to focus on when you're precepting students, and making sure at the very beginning that those expectations are made. And then the next thing I want to talk about is customizing student learning. And for sake of time, I won't read through this entire thing, but this is, if you go to habitsofpreceptors.org, this is a preceptor tool that you can use to evaluate yourself. And one of the categories on there was creating a positive learning environment. So you can also score yourself and self-assess on your own precepting habits and rank yourself anywhere from developing habits to master habits. And so with that, I'll turn it back over to you.
So one of the things I like to reflect on throughout the student learning process is trying to remember their perspective. I mean, you may even just want to ask their perspective. So look at your rotation plan. Does it involve too much, or is it too little? Are you asking them to do things that you don't expect them to know how to do, or things that you personally don't want to do? So are you just giving them busy work that you don't want to tackle yourself? Are you asking for too much or too little? Are you expecting them to do things how you would do them? Have they been taught something different from another preceptor? So again, back to the not reprimanding, creating a positive environment. Have they been taught something or how to do something differently by another preceptor? And so when they don't do it the way that you would like, did you set your expectations appropriately, or are they doing it how they've been taught to do it? I think it's also important to remember to ask students for feedback on the rotation, on the tasks, projects, everything that you're having them or letting them get involved with, having them practice that upwards feedback, I think is also an additional skill for them to learn for their future career, whether it be they're giving feedback to their boss in the future, or pharmacist in charge, or managers. Asking them for that feedback and allowing them to practice giving feedback to yourself is very valuable. Customizing projects, I think, is another important thing to do for students. So I personally have set projects that I have them do, but I give them very general guidance on that. So it allows them autonomy in finding a journal for their journal club, picking a presentation topic, deciding what type of topic discussions we're going to have. So obviously they have to be AmCare focused, but they can give me examples. So they're expected to come up with these ideas themselves for their specific topic or an area that they want to grow on, and then come to me with that, and then we'll decide together if that sounds good. And then for like the journal club, I asked them just picking an article that was published in the last 2 years. I also set up a couple of interprofessional shadowing opportunities for 2 half days throughout the month that they're on rotation with me, so that they can shadow a physician or a social worker, a dietitian, some other specialty, and maybe that'll assist them in accomplishing some type of career rotation goal that they have. And then I think it's important to allow flexibility. So this comes up a lot more when a student maybe has me for their second AmCare rotation. So then at that point, maybe I'll remove them doing a formal presentation, and instead I'll do that type of project that I mentioned earlier, where a student was interviewing some of our support staff on our hospital follow-up process. I think that that allows them to build their CV, but it's also a win-win for myself. And then these last couple of slides, I'll breeze through a little bit more quickly, but they're more just reminders. I think things that are coming up in society. So remembering to be inclusive in your teaching, pay attention to your terminology. So things like house of worship rather than church, and depending on your specific student, learning about groups other than your own, and remaining open-minded. You may not agree with your student or the things that they have that they're talking about, but I think remaining respectful in that, and not trying to protect anybody, have the same expectations for all. And then when giving feedback, remember, be caring, warm, positive, optimistic, reflect on the SMART goals and their goals that they've created and your expectations.
Does anybody have any questions or comments?
Whitney, this is Ralph. I just wanted to thank you for a very informative, for both of you, you and Susie, for a very informative webinar. Very good information you shared. Thank you.
Yeah, thank you.
Thank you.
Awesome. Great. Well, thank you all for